Hi, I'm Dr. Guy Quill. I'm here to show you how to put together your Bunny PAPR. First, look at the parts that you have. The Bunny PAPR itself, your power supply, flutter valve fittings, fingertips that have been cut off from a glove to create your flutter valves, small rubber bands to secure the rubber fingers onto the flutter valve fittings, an anesthesia viral filter. This is what's used to protect patients during anesthetic cases, and this has a greater than 99.99% viral removal efficiency. Viral filter adapter, a plastic bag to serve as your hood, and finally, a strap to secure the hood around your neck. So, assembly is quite simple. Open your bag, take the PAPR frame and put it inside your bag. You'll notice the front of the frame is a little bit taller. The back of the frame has the ports for the outlets, and the top has a port for the inlet. This is where the filter is going to go. Find the seam of the bag and place the seam so it is about 4 centimeters in front of the filter inlet. And get it centered left and right. Hold it from the outside of the bag, stretch it over the position is needed. So there we are, 4 centimeters behind the seam. You don't want to put it at the seam or in front of the seam of the bag, because if you do so, you won't have enough space in front of the bag to get good air circulation. All right, so another thing to be careful about is getting rotation of the bag so it isn't twisted relative to the frame. So let's get that straight, correct. There we are positioned correctly. We take our filter adapter and partially screw it in. Now this is an OPP bag. OPP is not as flexible as polyethylene, so we have to fenestrate it after just a partial threading in. With a polyethylene bag, you can thread the adapter all the way in before fenestrating. So I'm going to use this blade and make 3 cuts. And now I can screw my adapter the rest of the way in and snug it against the sand flange. This forms an airtight seal that allows air to be excluded from the inside of the hood, except for the air that comes through the viral filter. The viral filter fits just like that. So all the air that's going to enter the hood has to get processed by this 99.99% viral reduction filter. Next, we add the flutter valve. So we have to prepare them. Now we've taken relatively flat fingers from an exam glove, and we want this to be really not a wrinkled fingertip, but one that's flat. You'll notice that the flutter valve fitting has an elliptical shaped end. Place your glove finger over the adapter and stretch it on there. Okay, and then align the flat portion of the glove so it is parallel with the long axis of the adapter. You add a rubber band to hold this in place. There, one valve is done. Let's do the other one. It's best to use the longest fingers from your exam glove, because the better valves are created with a longer segment. Once more, we're aligned with the axis, with the flat plane of the glove, secure with the rubber band. Now the tips of these glove fingers have been cut off, and the ideal amount to cut off is about 1/2 to 2/3 of the roundness of the fingertip. You don't want to cut it all the way down to the flat, because the exit point of the air should have its highest constriction at the very tip. We want the pressure drop to be at the tip so that the valve action works properly. Okay, so these two valves are ready to go. We're going to put them on the PAPR. You'll notice that the PAPR itself, if you look at the frame, when it goes on your head, it actually stretches apart. That's how it gets a custom fit for your head. But of course, the rubber band wants to hold it in the together position. But we actually want it to be able to stretch when you put it on your head. So be careful when you position the plastic bag. You don't want the bag to become the limiting factor in how well this spreads apart. Leave yourself some room. Go a little more lateral. And then put in your fenestration. Okay, so I'm screwing in harsh way. On the valves, we have to do our fenestration from the inside. Screw it in the rest of the way. Hold the plastic bag as you screw it in so it doesn't twist onto the frame. You want it to go down flat. An interesting behavior of old PP plastic is that if you fenestrate it and then finish twisting it in, you don't actually have to remove any of the plastic bag from the fenestration. It opens up cleanly for you. If you use a polyethylene bag, you actually have to remove some of the plastic. So once more, we're going to make sure we have some space. Notice I'm holding from the outside, partially screwed in. Do your fenestration. Keep on holding the plastic bag from the outside. Screw it in the rest of the way. Good. Now your PAPR's assembled. Before you use it, it's a good idea to plug it into your power. Turn on the fan. And make sure your bag inflates. Okay, so we have good inflation. And we can put this on. Notice I'm grabbing the whole unit by the band or near the middle of the frame. Don't hold it up by this part, because if you crank this way, you can fracture the loop by overstressing. Another place you can basically grab the PAPRs from the top. So let's go ahead and put this on. I have the fan running. We already know that it is inflating. Put over your head. It seats down much like a baseball cap for the band. I've got these centered left, right in terms of rotation. I bring the bag down. And I put my strap on around my neck. It only needs to be about the same as a a necktie in terms of tightness. You want it tight enough so it stops airflow, but you don't want to, of course, cut off your circulation. And we find it easier to use a Velcro. You can do some tugging of the bag forward to get yourself some space in front. And as you can tell, the PAPR's now on, it's functioning. I'm pressurized. Air is being cleaned as it comes through my viral filter. And my expirations are out the flutter valves. The flutter valves are there for safety in case this bag were to massively deflate, but as you can see, it maintains itself under positive pressure, except for during a very large breath, in which case it might go negative, and that's why we have valves in the back. But under normal breathing, the bag remains under positive pressure, or at worst, because the bag can deflate readily during deflation, it goes to zero pressure, and so we don't have reverse flow. Now, what we've created now is a completely sealed hood around my head that is filled only with air coming through a 99.99% efficiency viral filter. Of course, this device is not FDA approved at this point, and we can't make any claims as to actual viral reduction, but all the air that is allowed into the hood is through a viral reduction filter, which we do know works, and the filter itself is FDA approved for protection of patients on anesthesia ventilators. And there you are. Your Bunny PAPR is put together and ready to use. Oh, one more thing. I'm not wearing a surgical mask under this PAPR. I'm only doing that because we're doing a video and it's easier for you to understand me if you can see my lips move. But if you were to wear this in an actual patient environment, you actually should wear a surgical mask underneath the PAPR, or rather inside the PAPR. And the reason for that is, well, the PAPR protects you from anything in the environment around you. There's nothing that protects those that are in the room from anything that you breathe out. So that's why you should have a surgical mask inside the PAPR if you're actually using this.